professor of emergency medicine at the University of Tromso in Norway. He's been working in training Gazan doctors for the past 20 years. Mads, Nasser hospital being hit, the Israelis know what they're doing. Why are they attacking these facilities, even if there is a Hamas member inside? Because the international law is clear.
Well, first of all, because the Israelis do not care about international law at all, which has been demonstrated not only during this last massive attack since the 7th of October 2023, but WHO, the World Health Organization, has been documenting for the last 25 years that the Israeli military tactique during bombardment and attacks on Gaza and in the West Bank is to attack Palestinian healthcare. And not only the hospitals, also the primary healthcare centers and the ambulance services and the medical staff. Don't forget that more than 1,000 healthcare workers have been killed in Gaza, adding to the horrible numbers of journalists killed. These are well-known breaches of international law perpetrated systematically by the State of Israel. And our massive problem is that the international community, whatever that is, or at least the Western governments and the United States, have been granting the Israeli army impunity for all this time with their attacks on healthcare. I've been working in Shifa and in Al-Aqsa Hospital during Israeli attacks in 2006, 9, 12, and 14. And I've seen it again and again and again. And they don't even bother to have an argument. And of course, this latest attack on Nasser Hospital, which, by the way, is a key hospital to serve the people of southern Gaza. If they try to validate that with killing a Hamas leader, you know, there is no room for that in international law. You cannot do that because these hospitals, as you summed up, they are protected objects, just as the healthcare workers and the patients are. So there is nothing new about these Israeli attacks on hospital. Unfortunately, what is new is that the silence continues, and the Western governments could stand up now and say enough is enough. And of course, the only language that Israel and the US will understand is political isolation and economical sanctions. That is needed now more than ever to completely paralyze the economy of these war criminals.
And that call has been repeated endlessly for the past 18 months. But as we know, the politics is separate from the humanitarian disaster. I mean, they're related, but they're separate. What I'm trying to say is that the Americans might influence the political situation more than anybody else. But the humanitarian situation is real and needs to be addressed right now. We've also had news in the past half hour or so that the International Committee of the Red Cross says one of its offices, or its office in Rafah, has been damaged by an explosive projectile fired by the Israelis. When was the last time you spoke to your colleagues in Gaza, Mads?
2 days ago, and we were discussing the situation for the hospitals, which is extremely difficult. Look, I just got the Minister of Health list of zero stock drugs or essential medicines and zero stock essential disposable for the medical sector for the hospitals, and 40% of the essential drugs and medicines needed to run the hospitals are at zero stock in Gaza now, and 60% of the essential medical disposables needed to run a hospital are out of stock are at zero stock rather in Gaza now. And one of the largest groups which is at zero stock are the items needed for orthopedic surgery, which is of course a large part of what they are doing in the operating rooms in Gaza now, the fractures, the amputations, and so on. And one more thing, when we're talking about numbers, it's been news that the number of killed has passed 50,000 people in Gaza now. But there is a recent Lancet report, another report, having analyzed the estimates of killed, and they found in a very sophisticated statistical analysis that the actual numbers now reported are 41% too low. So actually the number 50,000 should be multiplied by 1.41. Then you get 70,500. And add to that the estimated 10,000 killed, still missing under the rubble of the bombed buildings. Then you end up at the number 80,500 killed since the 7th of October. 80,500 Palestinian men, women, children. 70% of these 80,500 are women and children. And one more extremely important study just published, the life expectancy in Gaza, which is a medical construct. How long can you expect to live when you're born in a country? The life expectancy in Gaza, for the people of Gaza, has dropped by 35 years within the last 12 months, which means that the life expectancy is now half of what it was before the 7th of October. This has never, ever been seen in any society. So actually, through starvation, lack of water, lack of hygiene, lack of medical services, and the constant bombing and the siege, all of these factors together are now stealing half of the expected lifetime for anyone born in Gaza, which is a horrible number, and it should make the world wake up.
Mads, these are facts and statistics that you are quoting to us, and they literally are sending shivers down my spine. And I'm supposed to be a neutral presenter of international developments. But I wanted to ask you, away from the facts and the stats, something about human sentiment and philosophy. You mentioned all the facilities that are being attacked. Of course, we had an attack recently, just a few days ago, on the only cancer treatment center, which was built also with Turkish help. So these kind of attacks and the way the Israeli tactics are that when there is a missile strike on a particular location, they wait for the medical teams to arrive there and then attack again. Is that designed to sap the will of the people? Do you find that it's actually having that effect on the people of Gaza, or do they commit themselves to being even stronger despite these attacks?
That's a very crucial question. And I'd just like first to say that I knew the Turkish Friendship Hospital very well. I've been working there for the last 3 years together with Dr. Sobis Geik, who was the medical director. And the Palestinians had designated this as the central cancer hospital for all the Gaza Strip population. We were actually planning to start installing a radiation unit there the fall of 2023 when the attack started. So this was a beautiful hospital, a beautiful gift from the people of Turkey. And the Israelis first bombed it in the fall of 2023. Then it had to be evacuated. Then they took control and used it as a military command center. Imagine that, using a hospital as a military command center. And then finally, now they blew it up. And to your question about the spirit, the resistance spirit of the Palestinian people, it can never be stopped. It can never be killed. What they aim to do, of course, the Israeli occupation army, are twofold. They want to eradicate any civilian structure that signals that there is a people living here. Hospitals, schools, universities, archives, libraries, museums, everything that signals an organized society. That is the epistemicide, the eradication of the knowledge of the Palestinian people and the indigenous people society. And of course, the second aim is to undermine and quell the sumud, the steadfastness and the fighting resistance of the Palestinian people, which is not only the military resistance, which I, by the way, support, just as I support the military resistance of the Ukrainian people within the limits of international law, of course, but this attempt to quell or to stop the willingness of the civilian society to resist the occupation is a hopeless goal, because the Palestinian people will never, ever give up their struggle for their land, for their country, for their sovereignty. And as Mahmoud Darwish said, as long as the Satar and the olive trees are staying, we are staying. So this is a hopeless ambition. It is the old colonial ambition of the colonial settler nations. They tried it all over the world in the global south. They will not succeed in Palestine because the Palestinian people are fueled with persistence and with sumud. And I have this thing on my desk, which is from, again, Mahmoud Darwish. He says, "We Palestinians suffer from an incurable malady of hope." So, you know, Netanyahu, just forget about it. You will never conquer the Palestinian people. And we who stand in solidarity with the Palestinian people, will never stop working night and day to support their right struggle.
Interesting. That word hope, Mads, it's a forward-thinking emotion. So it's almost always positive. You can only hope positively about the future. You can regret the past, but hope is about what's coming. Mads, thank you so much for sharing your thoughts with us on TRT World.